kids that are aged 1 year or younger are now diagnosed with a food allergy. Heidi Young is a paediatric nurse and says introducing common allergy foods to your child is essential as they need to understand what they're eating. Heidi joins us now to explain a little bit further. Welcome to Ticker News today. How are you?
I'm good, thank you. How are you?
Yeah, going well. So this problem, food allergies for children, tell us a bit more about it. I mentioned they're pretty striking numbers, I guess, when you put it that way, isn't it?
Yeah, it's definitely classed as its own kind of epidemic here in Australia now. So 1 in 10 under 1-year-olds has a diagnosed food allergy now in Australia. So that's the key word there is diagnosed. So there'll be many more out there that probably haven't even seen a doctor and been diagnosed. So the number's probably higher. And Australia is the worst country in the world for childhood food allergy, and we don't really know why. There are some theories. We're doing some work around it, but yeah, it's pretty full on nowadays. And when people look back and say, oh, there wasn't such a thing, in my day, like when the grandparents say, oh, it's just all intolerance or etc. It actually was much rarer 30, 40 years ago. There wasn't the numbers there is now. So there has been a huge increase in recent years.
That is extraordinary to think the worst in the world, and we're trying to figure out why. So what are the top and most common allergies that we see?
So there is a group of foods that are responsible for 90% of childhood food allergies. So that's your milk, dairy we'd call it, and your tree nuts, peanuts. Peanuts are actually legumes; they're not actually nuts. Sesame, soy, fish, shellfish, and wheat. And egg. So they're the top 9 foods, and they're responsible for 90% of food allergy.
So how do we recognise that there is a reaction, and is it by a certain age in a child? I mentioned under 1 year of age. Is it a certain number of months that we start to understand more?
So basically, it normally comes around when people start to do the introducing common allergy foods. Yep. That's when we start to see it more just with the weaning. But it can look different in every child. So some children will just show just some hives like around the mouth or the face. Other children will just go pale and floppy when their blood pressure drops with no other symptoms. It can look completely different depending on the child and that allergy that day. It's just, there is no one way that it looks, so it can be really, really frightening.
So how can we respond? What sort of tips do you have? We see the reaction. What do we do next?
So if you're feeding your child and you see that they're having a reaction, the first thing obviously is to stop. The first thing would be familiar with, which is what we do at the Nest. There's so much literature out there to make yourself familiar with what the symptoms are, and then stop giving that food immediately and keep an eye. If the symptoms lay within the mild to moderate, which can be abdominal pain, vomiting, just some hives around the mouth or anywhere on the skin, maybe swollen eyes, swollen lips, then that's all mild to moderate symptoms. We can just watch and wait. You should take them to the GP the same day to get checked out, but you can give antihistamine. But if any of the symptoms progress to what we call severe or anaphylaxis, which is the breathing difficulties, persistent cough, going pale and floppy or feeling dizzy for an older child, or a swollen tongue, then we need to be calling an ambulance. That's the only thing we need to do in that position.
No, absolutely. Yeah. Heidi, thanks so much for joining us. Of course, a worrying trend, but it's good to learn a bit more about this. Appreciate your time today.
Thank you.